In this presentation, I'm going to talk a little bit about the different things that can cause low back pain. So broadly speaking, low back pain will be divided into specific low back pain and non-specific low back pain. And when we're talking about specific low back pain, it usually implies that the MRI scan has demonstrated a structural cause for the pain, such as a disc bulge, pressing on a nerve root, and this will explain the pain, and it is then called specific. And when it is non-specific low back pain, it usually implies that a structural cause has not been found on the MRI scan. Now, this means a specific pain generator hasn't been identified, not that one does not exist. So then there's a grey area where there is low back pain. There are some changes on the scan, but it is deemed that the changes on the scan, which may be wear and tear related to age, are not sufficient enough to explain the pain. And a surprising number of patients will fall into this category. And so this raises the question, what is actually causing the pain? So I spoke in the low back pain facts presentation a little bit about the differences between the types of pain, but just as a recap, so nociceptive pain is simply the pain that is elicited by activation of pain pathways, and it's also called mechanical pain. Neuropathic pain will imply that maybe there's a nerve root compressed that's causing pain that goes down your leg. And then nociplastic pain is a more recently described pain subtype, but it probably explains a lot of ongoing chronic pain, and it essentially refers to the amplification of pain signals within the brain itself. And it can occur because pain is initially a protective mechanism, and when you are experiencing pain, the brain is priming itself for potential danger, but this can lead to the establishment of ongoing pain signals as a brain wants to protect itself from potential harm. However, for the most part, there's no ongoing potential harm, and it has been demonstrated that a lot of the nociplastic types of pain are also exacerbated by things like catastrophizing and worrying about pain for the future. It wouldn't be unusual for there to be components of all three, and probably most commonly the nociceptive and the nociplastic types of pain. Pain definitely has a significant emotional component. This has been well documented at this stage through functional MRI. When the areas of your brain that are involved in worry and anxiety are more active, pain is experienced as more significant or more severe than when these areas aren't active. So having these kinds of thoughts will have a negative impact upon your pain experience. But if this type of thing happens to you, you shouldn't feel alone, because it is almost universal. It's just naturally what we do when we have a pain. But the good news is that studies have also shown that challenging these negative beliefs and forming a more positive outlook on our future with or without pain has a positive impact upon the pain experience going forward. So when it comes to the low back itself, we need to think about the structural areas that can be involved in pain generation. So degenerative disc disease is something that almost every patient with low back pain who's had a scan will be familiar with. But what does it mean? So we have a number of structures within the spine that could contribute to the experience of pain. So there's muscles, ligaments, tendons, facet joints, vertebrae, and intervertebral discs. And all of these components are subject to biomechanical, degenerative, and traumatic stressors, which can accumulate over time and contribute to the experience of non-specific low back pain. When there is damage to any of these structures, the body's response to this is to try and heal, and it does this by forming new blood vessels and new small nerve fibers. And I guess these can then contribute to the continuing pain, but they won't necessarily be seen on any structural imaging. Degenerative changes in these structures can lead to the mechanical or nociceptive pain, as all of these do have small sensory fibers, especially once the healing process has begun. So when we think about pain in terms of its mechanism, we know the structures in the back are subject to a little bit of wear and tear over time. This can definitely lead to pain through activation of pain pathways, and that is called nociception. But when the nociceptors or the pain receptors become activated in a more chronic or longer term fashion, the pain can then happen with activity that wouldn't ordinarily induce pain. And this is just called kind of sensitization of the pain receptors, and it can contribute to the overall experience of pain. So an example of this would be an action such as rising from a seated position wouldn't ordinarily cause pain, but in someone with sensitized pain receptors, then the pain might be induced by such a movement. It doesn't necessarily mean there's any damage being done or being caused by the movement. It's just that the receptors are more sensitive. And if the duration of your pain is long, so greater than 3 months, then there will be a higher chance of developing the nociplastic type of pain, and that was the pain amplification in the brain. And this is because a longer duration of pain is associated with a greater emotional processing, and things like catastrophizing and worrying about the future are more likely to happen if you have pain in the longer term. So when we think about the sources of pain within the lower back, we can think about discogenic pain, pain generated from facet joints, musculoskeletal pain, pain from arthritic changes in the back, pain from nerve recompression, and pain from compression in the spinal canal. So I just put this up here to show us again the kind of what normal and abnormal looks. So when you have a scan of your back, like this is looking side on, these are the vertebral bodies, these are the discs, that's what a normal disc looks like. Then you have a degenerated disc, you have a little bulging disc there, and then you have a herniated disc, so that's when much more of the disc has bulged out. You can have a thinning of the disc, and then you can have osteoarthritic changes around it, and this just shows on this side what the normal spinal column looks like. And again, here we have some changes, so you're forming little bony spurs there. The disc is a little bit pressed and thinned, and just when a disc is pressed and thinned, it's just more likely to contribute to pain within the disc as well. You have what's called an end plate, and that also can be subject to some wear and tear. So we have intervertebral discs or discogenic pain, and we're all familiar with the term, like a disc bulge or a disc prolapse. So when there is extrusion of the disc material into the surrounding soft tissue, that can contribute to pain. Again, the natural response is to try and repair it, and it does this by forming new nerve cells and blood vessels on either end of the disc where it connects with the vertebral body. There's what's called the end plate, and they're also subject to wear and tear, and they are called modic changes, just after the person who first described them. So if you've gotten the result of your scan and you see the word modic on it or end plate changes, that's what this is referring to. There also can be a little bit of degeneration of the discs, and you can form little osteophytes or bone spurs, and if they press on tiny nerves, that can contribute to pain. So often these changes are reported as non-specific, especially if there is no sign that the disc is pressing on any nerve roots. And how much they contribute to pain is still debated, because the reality remains that sometimes patients will have a scan for another reason, and they'll show lots of changes on their back and they won't have had any pain at all. So that's why the interpretation of the scan and the interpretation of pain can be quite complicated. The facet joints are joints in the vertebral column, and they can be a significant source of localized pain. So you might have heard of facet joint arthritis or facet joint changes. They essentially connect the vertebrae with the spinous process of the back. So the bony bits you can feel in your back, the facet joints join the vertebrae or the front part to the back part, and they are subject to arthritic changes. They're there to allow a greater amount of flexion and movement around the spine without leading to excessive movement. and contribute to overall stability of the spine. In general, what happens first is that the discs are the first to degenerate, and then they can end up putting extra pressure on the facet joints, leading to facet joint changes later on. It is likely that musculoskeletal pain will also contribute to chronic low back pain, even when there are degenerative changes seen on a scan. And that's just likely based on the age of the patient. And it's because over time, if you have any pain, the muscles will try to compensate for that. So some can become overused, some can become underused. And that's again why things like physical activity will have a hugely important role in helping to manage some of the symptoms, because it can help you to train the muscles to be used properly. There can be alteration in muscle size, composition, and coordination that differ from those who do not have pain. So sometimes having musculoskeletal pain can lead people to avoiding activities, and that will eventually only compound the pain they are experiencing. You can also get pain just simply from osteoarthritis in the back. We all know that's associated with aging. There can be accumulation of minor damage over time. There can be a build-up of these changes within the discs, which can also contribute to arthritis. When patients have intervertebral discs that are degenerating, it can lead to a loss of height of the disc, and this can increase the chance of it bulging or herniating. The changes in the intervertebral discs, like I said on the other slide, can then put a bit more pressure onto the facet joints, which can compound the overall symptoms. Then you can have some radicular pain, and again, this usually implies that there's some compression of a nerve root in the back. In general, this will involve pain that will radiate maybe down the back of the leg or the front of the leg, or there might be associated numbness or tingling. If a disc presses into the center of the spinal canal, it can cause compression of the nerve roots from both sides, which may lead to pain or tingling in both legs. So this would fall then into the category of neuropathic pain that is caused by nerve compression or nerve root injury. It has been demonstrated that the extent of the disc prolapse or herniation may not necessarily correlate with the severity of the pain. So this would be where you might have a scan because you have severe pain, yet the scan shows only a minor disc bulge, and only like barely pressing on the nerve root, and that can be confusing for the patient. But again, it really relates to the fact that pain is complex. Then you can have pain from narrowing of the spinal canal, so we call this spinal stenosis. So sometimes the degenerative changes that occur can lead to a narrowing of the space that of the spinal canal. So the nerve where the nerve roots come together can be a little bit tightened. But sometimes, again, you do a scan on a patient for other reasons and the canal is very tight and they haven't had any symptoms at all. However, when they do cause pain or symptoms, it can depend on what you're doing, and it can depend on if you're walking a certain distance. So if you walk a certain distance and your pain comes on and then you rest and it goes away, this could imply that there is a bit of narrowing of the spinal canal. And this is because if you have a narrowing in the spinal canal, doing activities like walking or things like lifting will involve extending your spine, which further narrows the space. And then when you stop doing that or you rest, you'll increase up the amount of space again. The medical term that is given to pain that is caused by spinal stenosis on walking a certain distance that can actually be variable is called neurogenic claudication, and sometimes the pain is accompanied by pain that will also extend down the legs. So to conclude, low back pain can have many causes that relate to the anatomy of the lower back and the changes that can occur with aging. These are happening all the time. They're happening in everybody. Beyond the age of 30, you can begin to see degenerative changes in the back. There's nothing you're doing to cause this. I want this presentation just to try to highlight the things in your back that can cause pain. I don't want to be causing any excessive worry about these things. They happen in everyone, and most of the changes are minor. Often the pain can be worse than the age-related changes on the low back MRI scan would suggest. This can cause a bit of confusion and fear because it can then be felt that the pain might never go away. But really, the reality is that the MRI scan can only tell you so much, and really the scan is being done to assess if there is a role for any other intervention or any treatment, such as an injection or a surgical procedure. Pain is really complex and can have many contributing factors. As I've described here, there are different types of pain contributing to the overall pain experience, and there are different structures in the back that can be the source of pain. So I just wanted to do a presentation explaining a little bit about the different causes of low back pain, because a lot of patients are experiencing it, and having a greater understanding of what is in the back, and the fact that even though the structures might be causing you pain, they're unlikely to be causing you any serious damage, and just kind of to increase the awareness of what is in the lower back and how it can generate pain. Thanks.